I'd like to take a few minutes to go through some of the more frequently asked questions and concerns that are posted on this YouTube channel. Now, there's some themes that run through a lot of these questions and comments. One is that often the question is answered right in the video. So if you just watch the video to the end and maybe even listen to it a second time, you'll see that almost all the answers are actually in the video. Another thing is that I encourage you to take a look at my other materials. I can't cover everything in a few-minute video, of course, but I have thousands of blog posts in my williamdavismd.com blog. I, of course, have something like 12 books, I've lost track how many books, that detail a lot of the rationale and contain, by the way, hundreds, if not thousands, of scientific references and the rationale for some of the things I say. And of course, there's other videos on this YouTube channel that cover huge numbers of topics that are of interest. But another thing that emerges is that I fear that so many of you are falling, and this is not true just of you, it's true in general, of the public in general, and that is we're falling victim to the tidal wave of misinformation. It's becoming increasingly difficult to decipher what is true, what is a credible source, from what is nothing more than marketing or deception or disinformation or somebody trying to make a buck off of you. This is sadly very true. Now, I don't have a full answer for that. It's going to take us probably decades to find out a better way to get our information, but several base rules are important to know. One is, consider your source. If it's the scientist who performed the study, that usually is a good source, but even that sometimes has to be questioned. But in general, somebody performing the actual science is more credible. If someone is selling something to you, like a longevity supplement, you know they're trying to make money off of you, even if they're hawking nonsense. And the vast majority of conversations and products in this longevity space are absolute nonsense or based on nothing more than evidence that comes from worms and mice. And we have no idea if it applies to humans. Are you willing to spend hundreds of dollars and listen to somebody's argument about longevity when the evidence is almost non-existent outside of animals or worms or flies? But if you're getting information from a blogger, a YouTuber, whatever, consider that person's credibility. So if it's a housewife, I'm not making fun of housewives, but if it's a housewife who just happened to read somebody else's marketing, that is the echo chamber of the internet where people just repeat things other people told them, you know that's not very credible. It could be true, but more than likely it's not true. So just be very careful. I don't have all the rules. Nobody has all the rules figured out in this age of misinformation, disinformation, but be very skeptical what you're being told online. I've tried to make it my business to expose falsehoods. So my most successful book, of course, was Wheat Belly, where I took down the whole notion that eating more healthy whole grains was good for health, because in fact the opposite is true. And that science is quite solid, by the way. But it's not talked about because we have the dominance of big food and big agribusiness telling you such things as breakfast cereals are good for you and necessary for. This is completely untrue. If you look at the evidence detailed in the books, Wheat Belly books, why, for instance, the amylopectin A triggers formation of small LDL particles that cause heart disease, why the amylopectin A also causes glycation of proteins, neuronal proteins, that leads to dementia, why it raises blood glucose to high levels and is a big contributor to visceral fat expansion, weight gain, and type 2 diabetes. In other words, the science is already done, but you can't rely on most information sources to tell you that. So let's get to some of these questions that I picked as they're the most common, most frequent, or most concerning. So the first question comes from Marco Shine 9129. My calcium score reading, and by the way, this is based on a video I posted, The Real Way to Stop or Reverse Heart Disease. So Marco Shine 9129 asks, my calcium score reading is 1100. I'm very concerned. You mentioned baby aspirin, 40 milligrams of Lipitor, and others. Can you suggest anything else? I mentioned those things as being ineffective, not effective. So in other words, we helped publish these data 30 years ago. If all you do with a high calcium score that high, a score, by the way, of 1100 means your likelihood of dying, having a heart attack, sudden cardiac death, or needing a procedure is about 15% or about per year. So over the span of about 7 years or so, it's virtually guaranteed something bad happens to you. So you have a crystal ball. What can you do to stop it? Well, the point I made in that video was if you take what conventional cardiologists advise, a baby aspirin, low-fat diet, high-dose statin agent like Lipitor, exercise program, you'll have no impact at all on the progression of that score. It will still increase 25% per year as if you did nothing. So what I'm arguing is there's many things you can do, and that's what my programs are based on. We eliminate the dietary sources that cause small LDL particles. That's the real cause that drives coronary disease and the growth of coronary calcium scores, coronary atherosclerosis. We address common nutrient deficiencies like vitamin D, omega-3 fatty acids, iodine, and magnesium that when combined help reverse the insulin resistance and inflammation that drive coronary disease. And then we address SIBO and endotoxemia. So you can see it's not one little quick answer. It takes 30 seconds. There's some work. And I encourage you to do some of the work. Sadly, there's a lot of laziness or overexposure to media involved here. It does take some work. After all, we're talking about reversing heart disease or reducing the risk of you dying. So I can't say take supplement X and it does the job, right? There's more you have to do. But one thing is clear, and that was the message in this video, that doing the conventional answer, what my colleagues continue to this day call optimal medical theory, does not work. So in order to find something that does work, see all my other materials. It's detailed in full detail, dose, where to source these things, how to do it. It's not that tough, but it's more than I can cover in just a few-minute video. Another question posed on the real way to stop or reverse heart disease comes from Clem Dane. 3,600 milligrams of omega-3 per day. The one I've been taking, Mega Red Krill oil, is 350 milligrams, and some of that is oil. Am I really supposed to take 10 of them? I'll be spending $240 per month on that alone. That's why we don't take krill oil. So the krill oil industry is guilty of massive deception. Once again, people eager to sell you something to make money. So krill oil will be fine because it's a source of the carotenoid astaxanthin and a little bit of the EPA and DHA, but not enough to make a big difference in your cardiovascular risk nor facilitate regression of coronary atherosclerosis. You need to take fish oil for its higher content of EPA and DHA. You can continue to take krill oil, but you cannot rely on it as a source of EPA and DHA because the quantity contained is too small. And as you point out, you'd have to take a whole bunch of capsules and spend a lot of money to achieve the dose that's necessary. So don't be confused by the ridiculous marketing of the krill oil industry, who say such things as our krill oil is 40 times more potent than fish oil. What they're referring to is the antioxidative capacity in the ORAC assay of the astaxanthin. There is no antioxidant in fish oil, so it's nonsense. They fooled you, okay? So it's fish oil. Now, you want to be selective about your fish oil. You want to get one that's purified, high potency. There's a bunch of good products out there. See my other conversations. You want product recommendations, products that I'm not selling, that I'm not telling you to buy my products, okay? Another video was the critical importance of the female vaginal microbiome. So Susie1907 posted this comment. My wife, I guess her husband posted it. My wife and I started making El Roderai yogurt. Following your guidance, we were thrilled when her bloating significantly improved in just 3 weeks. However, shortly after, she developed severe skin itchiness and redness, which has now been diagnosed as chronic urticaria. It's been 3 weeks of steroid treatment with no relief. We are devastated and unsure if this could be a reaction to the strain, batch, or perhaps an intolerance. We're based in India, and the capsules were sourced from Oxyceutics via a friend in the U.S. We're hoping for any insight, similar case reference, or guidance. So this is now, as best you can do from a distance, right there in India, this is almost certain to be an example of histamine intolerance. Let's talk about that. So there are people who are intolerant to histamine, a normal, natural, necessary signaling molecule. If we turned off all the histamine in your body, you would die. So it's like insulin. Without insulin, you would die. And so you need histamine. The problem comes when we restore Lactobacillus reuteri, a very beneficial species, right? One of its properties is to increase the production of histamine. But if you're already histamine intolerant or on the edge of histamine intolerance, because you've lost dozens, if not hundreds, of bacterial species in your gastrointestinal microbiome that were supposed to be metabolizing histamine. In other words, when we tip you over the scales a little more histamine from the Lactobacillus reuteri, and you lack the many species that were supposed to metabolize the histamine for you, it can bring out histamine intolerance and all the phenomena you're talking about, like the rash, the hives types rashes. So the solution is hold back in the reuteri for now and address the SIBO. Now, I would, in general, I advocate the use of SIBO yogurt, my recipe for SIBO yogurt, to take care of SIBO. But in this situation, it can make your histamine intolerance worse. It's the one situation where we don't rely on SIBO yogurt. In this case, I push people towards the herbal antibiotic regimens, the two regimens that have been at least partially validated, the Candibactin AR plus Candibactin BR, or the FC-Cytal with dysbiocide, to eradicate the fecal microbes that have taken over your small intestine and have caused a loss of histamine processing or metabolizing species. Only then can you start to add back beneficial microbes, such as those in SIBO yogurt, and not have to tolerate histamine intolerance. So it's a little bit complicated answer, but know that you just can't accept, I can't take the reuteri or the SIBO yogurt, because you have very severe case of SIBO, and unaddressed SIBO leads to long-term, often serious health complications. So if this makes sense, see my Super Gut book, see my many YouTube videos, see my blog, see my Define Health podcast, but take some homework to understand these issues. And so take a look at all those materials to get a better understanding of what you're trying to do. Another question posted in the critical importance of the female vaginal microbiome is how can consuming the good bacteria like Lactobacillus crispatus reach the bladder from the stomach? Well, it's not from the stomach, it's from the gastrointestinal tract, right? So stomach, duodenum, jejunum, ileum, and colon. Nobody knows for certain, but it's most likely via skin contiguity, nearness in the skin in the area of the body called the perineum. In other words, a woman takes Lactobacillus crispatus and other microbes, it colonizes some parts of the gastrointestinal system and then somehow gets to the vagina and then in turn gets to the bladder. Now, there are no known direct connections. There's no vaginal urinary connection that anybody knows of, but they're very near each other in the perineum, the groin area. So that's the presumptive method. But it is clear, emerging science tells us that there's this phenomenon called translocation. Sometimes it's a good translocation, like a microbe translocating from the colon, say, to the vagina and then to the bladder. But it can also be bad for you. For instance, how does Fusobacterium nucleatum in the mouth get to the colon? Well, you think by swallowing, right? Well, it can do that, but it's also been documented that it enters the bloodstream. Fusobacterium nucleatum enters the bloodstream and colonizes the colon, where the evidence, sadly, is quite good. It is a major driver of colon cancer. Think about that. Colon cancer risk in many instances starts in the mouth. So if you're going to prevent colon cancer, you just can't have a colonoscopy. You've got to go further. Maybe characterize your stool for the presence of Fusobacterium. Maybe characterize the oral microbiome. And if you have Fusobacterium, take steps to reduce or eradicate that microbe. How about the appearance of Porphyromonas gingivalis in the brain? Where did it come from? The mouth. So another example of an unhealthy form of translocation. These phenomena are only beginning to be deciphered, but you can see that it introduces a whole tangle of microbial interactions. But know that Lactobacillus crispatus can translocate outside of the gastrointestinal tract. Now, some questions that were posted on the Managing High Blood Pressure Without Drugs video. He Reigns 888 says, the Super Gut book states for SIBO yogurt to ferment for 36 hours at 106 degrees. Here, Dr. Davis says 100 degrees for 36 hours. Which is it? Well, here's the thing. The microbiome, the science behind the microbiome, is evolving very rapidly, right? Things are changing really every day or every week. The original recipe for my SIBO yogurt, that is, 3 microbes that colonize the small intestine where SIBO occurs, small intestinal bacterial overgrowth, SIBO, and are known to produce bacteriocins, natural antibiotics effective in killing fecal microbes that dominate in SIBO. So the original formulation was Lactobacillus rhodori, Lactobacillus gasseri, and the spore-forming microbe Bacillus coagulans. Over time, we found that Bacillus coagulans was not very reliable in fermenting in a dairy liquid, dairy substrate. So we replaced the Bacillus coagulans with Bacillus subtilis, much more reliable fermenter and a better producer of bacteriocins. It has a broader range of action against more microbes, both gram-negative and gram-positive. The gram-negative and positive describe how they stain under certain staining conditions under a microscope. The rhodori and gasseri better in killing gram-negative species like E. coli, Salmonella, Campylobacter. The Bacillus subtilis better at killing gram-positive and gram-negative. But the subtilis ferments a little different temperature. The coagulants likes bigger, higher temperatures, like 115 or higher. So we accommodated that by the higher fermenting temperature of 106. Not high, because if you go higher than that, you start to kill the rhodori and gasseri. The subtilis is more versatile. It ferments at lower temperatures. So going back to our standard 100 degrees Fahrenheit, or roughly human body temperature, works just fine for the subtilis, and I think it's better. The original formulation, as described in the Super Gut book, does work, by the way. Either co-fermented or individually fermented species, those 3 species. But I think you'll get best results by individual fermentation. Rhodori, gasseri, now subtilis. But you still can co-ferment. You'll have lower counts of the microbes. But so far, it's worked just fine. We will do a formal clinical trial. We can't do it with yogurt because we can't have people making yogurt on their own at home as part of a clinical trial. So the details of that have not yet been worked out. Okay, another question or comment under the managing high blood pressure without drugs from G. Ferguson 28. About 6 weeks ago, I went on a no wheat, grain, sugar diet, along with consuming at least half a cup of rhodori yogurt a day. I had a blood test yesterday, and I was surprised to see that my cholesterol was higher, 262 milligrams, and my LDL cholesterol also 173. I'm normal weight, normal blood pressure. These numbers are actually higher than when I had a blood test last year when my diet was much worse. What are your thoughts? Well, this is why I tell people, take a big, thick black magic marker and cross out total cholesterol and LDL cholesterol. These are fictitious numbers. These are nonsense. This is outdated science that should have been abandoned 50 years ago. If you really want to know what's happening, so here's what often happens. Let's say your LDL cholesterol is not so good. It's high at 200 milligrams, right? You do great things in diet. You eliminate sugars and processed foods. You lose 25 pounds off your abdomen, right? Good things happen. And your LDL cholesterol is now 240. And the doctor, not understanding what he or she is doing, says, oh no, the diet's killing you. You're going to die of a heart attack. Not recognizing a number of things. That LDL cholesterol was not measured. It was calculated. You'll see it in your lab test. LDL cholesterol, in parentheses, calculated. It's not measured. Well, the calculation is easy to do, but it's deeply flawed. It makes a number of false assumptions, and it has nothing to do with reality. If we were to actually measure LDL particles, not the LDL cholesterol, which is a crude indirect marker for LDL particles, if we actually measured LDL particles, you would see that they went way down and that they shifted from small, very atherogenic, heart disease causing particles to large, benign LDL. In other words, the calculated LDL misled you. It fooled you, and it fooled your doctor into thinking that the only way to manage this risk is via a statin cholesterol or other drugs. No. So if you really want to know what the numbers look like, you have to do a lipoprotein analysis like an NMR, nuclear magnetic resonance. There used to be other methods, by the way, but they've all kind of fallen apart because of financial reasons. Not enough doctors use these tests because they've all been brainwashed by pharma to think that the only number to pay attention to is the fictitious LDL cholesterol. So you have to go for it. Now, if you want more on this, the rationale, the science, the 55 clinical trials that have been conducted to show that small LDL particle measurement is dramatically superior to LDL cholesterol. See my Wheat Belly book, my Undoctored book, my Super Gut book, my thousands of blog posts, my Define Health podcast, my other YouTube. So I've tried to make this as available as possible, but know that your doctor's been fooled, you've been fooled. So the fact that cholesterol went up for G. Ferguson is meaningless. And it hides what's really going on, which is a reduction in small LDL particles. Now, how about the questions and comments posted under how to get your hemoglobin A1C to 5% or less? Bacchus57 asks, can I add the bacterial cocktail, I think he means to what I call SIBO yogurt, like I mentioned earlier, to existing Greek yogurt and get benefits? No! So there's a problem with yogurt from the store, whether it's Greek yogurt, low-fat yogurt, non-fat yogurt, doesn't matter. For a company to call it a product yogurt, the FDA says, arbitrarily, that it must be fermented with Lactobacillus bulgaricus and Streptococcus thermophilus, because those have been traditional and safe microbes to use to make yogurts. Does it mean those are superior for health? Absolutely not. And so you have a fermented mixture in most conventional yogurts with those microbes. Now, some manufacturers do go farther and add other microbial species, but know that you're starting with those microbial species and typically at fairly low numbers, because if you're running a factory, you don't want to hear it takes days and days and days to make your product. You want to hear it makes your product in hours. So you want to hasten production for the purpose of maximizing revenue return. And so that's what you're buying in the store. You're buying something that has been fermented relatively briefly, typically 6 to 12 hours, fermented with microbes that really don't have much in the way of health benefits. And if you try to introduce new microbes, you'll get some reproduction, but you won't get the kind of high counts we're looking for. Recall that when we make our Lactobacillus reuteri yogurt, using my method of prolonged fermentation, 36 hours, at human body temperature, with the addition of some prebiotic fiber, like a tablespoon of inulin, and we count the number of microbes after fermentation, we get something like 300 billion per half cup serving. And I think that's the reason why we're seeing such wonderful effects, is we're getting high counts of selected species of microbes. We're not just taking off-the-shelf microbes from the store. We're getting very specific human-sourced microbes fermented to high counts, and so you really can't throw them into a conventional, not to mention a lot of products at the store have additives you don't want, high fructose corn syrup, sucrose, xanthan gum, gellan gum, other thickeners, because if you ferment for a short time, you add things to thicken it up to compensate for the thinness of the minimally fermented product. Another question, comment, the last one I'll cover, under the how to get your hemoglobin A1C to 5% or less, comes from IDG19. If you eat a few sardines or some salmon a week, you don't need to supplement with omega-3. In fact, new research has noted that omega-3 supplementation can be dangerous and doesn't benefit much. This is a perfect example of the misinformation that comes from people who have blogs or are selling you something. See, this is omega-3 fatty acid supplementation. I wish I could tell you, eat all the fish and shellfish you want, but we know with confidence, and I've seen it happen so many times. If you eat ad lib fish and shellfish, you will get mercury toxicity and cadmium toxicity, and that has their own level, range of adverse effects long-term, including cognitive impairment, cardiovascular disease, and cancer. And so we can't, sadly, in this industrialized world where we've contaminated the oceans and thereby seafood and shellfish. So our fish oil is a workaround. Does it have adverse? Of course not. I wish we could eat fish all we want, but we can't. So we use fish oil as a workaround. What about this idea of adverse effects? Well, a lot of that press comes from people selling you some purported alternative. So if it comes from some housewife or some blogger or some person looking for affiliate sales, they'll tell you things to steer you towards another product. Know that the evidence over the past 20 years has evolved over time, but the evidence is clear-cut now. Omega-3 fatty acid intake from supplements, maybe supplemented to some degree by fish consumption, has very powerful effects, despite the zigzagging of the information. If you want to see that information laid out chronologically, see my other YouTube videos on cardiovascular disease, as well as my blog, where I did post an update on this conversation, because there have been two really important studies, most of all, the HEARTS trial and the EVAPORATE trial, both using CT coronary angiography, that have shown that omega-3 fatty acids facilitate regression of coronary atherosclerotic plaque, while statin drugs do not. And so very enlightening studies that pretty much clinch the idea, in combination with the meta-analyses that show that omega-3 fatty acid supplementation does indeed reduce cardiovascular risk. Don't fall for the marketing once again.